Thank you all so much for having me. Of course, I'm here to talk about nutrition in Chordoma care, but also one of my favorite personal topics, food. I'm currently on the nutrition support team at Mayo Clinic Jacksonville. I did start a lot of my career mainly focused in working in oncology, so that's definitely one of my passions, where my background has stemmed from. So happy to be here with you. We're definitely going to go through the importance covering that in nutrition during and after cancer, recommendations specifically for prevention and during treatment, also management of nutrition-related side effects that can occur, cover some hot topics specifically centered around cancer care, questions about those, and then hopefully provide some additional resources for additional nutrition guidance if that's needed. So nutrition is very important, specifically for cancer prevention, survivorship, especially during treatment itself. General guidelines range from eating nutritious foods, fluids to help you overall feel well, reduce risk for cancer reoccurrence, other cancers, and specifically other chronic disease development. Many people often think they need to follow these specific diets. Maybe what they think of as healthy differs from what they truly personally need. That being said, not one size fits all. Many challenges do occur. Some people deal with certain side effects that others don't. That's why nutrition is so personally tailored. But by eating healthy most of the time, you can occasionally work into your eating plan something that might be typically outside of the framework. This might include eating like a restaurant meal, going to a social event, enjoying one of your favorite desserts, something like that. I like to personally say nutrition, following that specific healthy, balanced eating plan, 90% of the time, you can really splurge a little bit that extra 10% of the time. So we're all human, just keeping that in mind. These are specifically the American Institute for Cancer Research tips for cancer prevention. We'll go through in more detail, a little bit more, just some touch points. Always encouraged to be at a healthy weight if possible. Be physically active if you can incorporate exercise. Eating a diet that's rich in whole grains, fruits, vegetables, plant-based proteins, limiting consumption of red meats, processed meats, limiting consumption of fast foods, other processed foods that might be high in sodium, fats, all great general recommendations. Of course, limiting alcohol consumption, limiting consumption of sugar-sweetened beverages, limiting supplement intake, but we'll dive a little bit more into what these all mean, what you can do to reach those goals, those types of things. So specifically, recommendations include following this new American Plate picture guideline here that focuses on mainly choosing plant sources of food. Those are high in fiber, nutrients, and promote a healthy weight. And that overall reduces, of course, cancer risk. By mainly focusing on choosing 2 to 3/3 of your plate of colorful fruit, plants, vegetables, fruits, whole grains, nuts and seeds, that really promotes overall health. That can be anything from fresh, frozen, canned foods are still good choices. Specifically looking for items that say maybe low or reduced sodium on the labels. Those would be great. Some foods specifically packaged or packaged in sauces, those types of things that add additional salt, fat, things like that. So trying to aim for just the ingredient itself is definitely ideal. If you're choosing canned fruit opposed to fresh, choosing options that are either packaged in 100% juice or water. We want to aim for at least 5 servings of different colored fruits and vegetables every day. Whole grains, breads, starchy vegetables, very important. Also 100% whole grain options when able. So that can be anything from brown rice, pastas made with lentils, beans, multi-grain cereals, things like that. Those are all great examples. Also trying to try new things maybe. Non non-animal sources of protein, beans, legumes, lentils, peas, soy foods. Always good to have some variety if possible. And then the daily fiber recommendations are trying to aim for at least 30 grams of fiber daily or more. And that helps with other things like digestion, regular bowel movements, all the good stuff. Next on the plate is that 1/3 portion that would include those animal protein sources. So our protein needs do increase about 30 to 60% during cancer. So that's a significant amount. So definitely want to focus on protein. So lean animal sources, that can be poultry, specifically the white meat without skin if possible, seafood, varieties of fish, shellfish, lean red meats, eggs, reduced fat dairy, those are all great sources. Trying not to eat burnt or charred meat, fish or poultry, so that when you cook at such high heat, that can cause a carcinogen effect on those foods. So trying other low heat methods when cooking, such as broiling, steaming, things like that, just saute on the stove. Definitely much better to avoid burning or charring. Recommendations for red meat are about 12 to 18 ounces per week, so we don't want to have more than that. So that red meat sources would be beef, pork, and lamb. Other foods to include, definitely healthy fats. There's a lot of benefits to those. Cooking with healthy oils such as olive, canola, avocado, those are great choices. Incorporating nuts, seeds, walnuts specifically, chia and flax seeds, as well as fatty fish, salmon, sardines, mackerel, those are all great sources of omega-3s. Those are fatty acids that actually decrease inflammation and help with the immune system strength. So those would be good choices to make. Other ideals, eating whole foods when possible. We want to choose foods that come closer to the way that they are in nature. Unfortunately, depending where we live, we all might not have a fresh garden or access to a farmer's market, but just doing the best we can. These foods retain more of their original healthy nutrients, fiber, things called phytonutrients and antioxidants that have other health benefits, specifically more than processed food. Overall leads to less inflammation in the body, and it's helpful to read the ingredient list on food packages. So the fewer the ingredients, typically the better. If you look at a box of cereal, the list for ingredients goes down the whole side of the box. Whereas if you're looking at, let's say peanut butter, a natural source of peanut butter would just include peanuts and salt. So limiting those, what's on the label, definitely going to be a better option. We want to eat the variety of fruits and vegetables. Of course, we're limited to typically what's in season. That's perfectly fine, but choosing different fruits and vegetables with different colors, definitely beneficial, help you live longer. They're also known to decrease inflammation again in the body, increasing that immune system from sickness, other illnesses, other diseases. Antioxidants actually protect cells from damage, and stick to those 5 servings per day of fruits and vegetables. Foods to really try to avoid and limit as possible. Processed foods and beverages might increase cancer risk. They're typically higher in those unhealthy fats, specifically sugar, salt, and other additives. Examples of this could be meats such as bacon, sausage, hot dogs, and deli meats. When it comes to deli meats, of course, that's a convenience food item, and that's easy to choose and grab. We're looking for things that aren't with added fillers, not smoked, with added nitrates. A roast turkey breast that's lower in salt would be a better option. Some of the boar's head meats actually have the American Cancer Society, the American Heart Association, label on some of those products, so they definitely comply with sodium guidelines. So limiting these other processed foods such as chips, cookies, candy, desserts, fried foods, great option, but of course a treat every once in a while. Like I said, 90% focus, 10% definitely aim to have a little bit more freedom. Limiting foods and beverages, specifically in added sugars though, tend to be really low in nutrients and fiber, so you're not really getting much benefits from those foods if you're ever enjoying them. So thinking about adding more, not necessarily take what you can take away from your diet. Beverages, we want to choose those plain teas, water specifically, coffee, low-fat milk, unsweetened plant milk. You can infuse water with berries, citrus fruit, fresh herbs, cucumber slices if you're not a big water drinker. Swapping desserts with maybe other nutrient-rich fruits every once in a while. Other reduced fat dairy products, nuts, vegetables, and hummus, another good option. Avoiding alcohol in particular. It's best not to drink alcohol for cancer prevention, so definitely a main focus there. Regarding food classification, of course, ultra-processed foods, they typically are going to be not the best for you. That's like the cereal I mentioned with the list of 50 plus ingredients there, whereas even though, let's say, a fresh bag of spinach is technically going to be considered processed, it's just picked, sometimes pre-washed, cleaned, packaged in a bag. So that would still be technically a processed food, but it doesn't mean it's a bad choice to make. So more of those whole regular foods that are in those packages would be best. Incorporating exercise is definitely a high focus point to maintain a healthy weight, balance hormones, help with regular digestion, reduce inflammation, boosting immunity. Of course, we can only start within our limitations, so collaborating with your healthcare provider would be important. It doesn't have to mean going out and running a marathon. It could be something as simple as stretching, walking, some strength training that doesn't even involve weights, something like that, chair yoga within limitations. So there's definitely room to add something if possible. Recommendations still stand at 30 minutes per day for at least 4 to 5 days per week. Getting in extra steps, parking further away from the grocery store, taking the stairs instead of the elevator, that's all ways to add additional movement in that you wouldn't normally think of. So definitely try if possible. Avoid supplements, so this can definitely be a confusing topic for many, especially with all the sicknesses, recent illnesses going around, but you can meet all your nutritional needs by a healthy diet alone. Whole foods provide many more benefits than supplements. Supplements are also typically can be very expensive. It's easy to overdo it on the supplements. Just because they say natural in the package doesn't mean they're safe to use. Some of them aren't even regulated. Some can also cause unwanted side effects with other medications you might be taking or treatments. So just keeping that in mind, always talk to your healthcare provider, whether taking a supplement, multivitamin, something like that would be right. And then a dietitian can always examine your diet and see if there's any certain vitamins or minerals or nutrients that you might be missing. So traveling is another big topic, specifically during treatment, that is of importance because we want to be prepared and have access. We don't want to just have no plan and have to stop at a fast food restaurant. That would be best to avoid if possible. So by planning ahead, we can be prepared. I did put together some products that I would recommend keeping on hand or taking with you. Number one key though, definitely aim to drink plenty of fluid, prevent dehydration. Consider taking water bottles with you. If you can, pack a cooler or a to-go bag, that's always a great plan. But these small snacks, frequent meals can keep your energy levels up through a busy day. Don't just eat a big breakfast and don't have a game plan for the rest of the day. So here's some example foods, drinks, fruits and vegetables, anything that's easy to peel, pack, grapes, bananas, dried fruits. Those are without added sugars. They make now just like freeze-dried products that are just bagged in single ingredient. Those are great options. Pre-cut vegetables, they have hummus single serving packages, Greek yogurt dips, those are always great. Yogurt comes in like a drinkable variety now, so you don't even have to have a spoon to eat it. Cheese sticks, cottage cheese, any of the single package nut packages are usually great. They have different mixes, unsalted options. Nut butters, they have the single serving options available. You can put with a piece of banana or apple. Other limited ingredient bars are great choices. Other single serving snacks such as pickles, olives, rice cakes, multigrain crackers, popcorn, tuna, hard-boiled eggs. If you can have nutrition or need like a protein supplement drink, that's always a great easy way to get protein and calories. And then other hydration liquids, water of course, broths and soup if you like something warm. They have thermoses that can keep them hot at the preferred temperatures for hours. Specialized electrolyte drinks that are more of like natural ingredients, such as like the Body Armor variety, coconut water, something like that that's a little bit more natural. Those would be all great choices. So through treatment, you might undergo some difficulties. So managing them nutritionally is definitely something to work through, specifically when it comes to swallowing difficulties. Texture changes, the consistency might need to be a main focus. You might have to have liquid options. Consider like a semi-solid that's moist, soft, smashable with a fork. Other soft foods, tender cooked, easy to chew, diced small pieces are usually best tolerated. Incorporating something like a blender, food processor to blend it to the consistency if you need that. These foods do not have to be bland. You can still season them, add spices, herbs, seasonings, anything like that to make them palatable and taste good. Dysphagia, that's swallowing difficulty, might require work with a speech-language pathologist, and that's okay. They can help incorporate exercises to improve that swallowing. Feeding tubes might be needed, but that's in severe cases, but still nutrition is definitely the goal. Other simple tips, sitting upright, taking small bites, avoiding those hard, crunchy foods, that's usually best tolerated. Some other challenges that might need to be managed could be something like taste changes. Taste really makes it difficult to enjoy food, so could also lead to something like unintentional weight loss, which we would want to avoid. So here's just some tips and tricks to help improve overall taste and make sure you're meeting your nutritional goals. It could be anything like if the food's tasting bland, adding those flavorings that could be good, like lemon juice, vinegar, ginger, spices, herbs. Specifically also, if, let's say, they're tasting too dry, moistening them with gravies, sauces, condiments that you enjoy or like, something like that. So definitely simple things that you can incorporate to still make sure you're eating what the amount that your body needs is important. Fatigue is a big one. It can have ranges from debilitation to just throughout the week, maybe you're just overwhelmed. It's impossible to prepare a meal for your family that night. This is going to be really important to remember some tips that could be helpful with making sure you're getting the nutrition that you need. So definitely preparing foods when you have those energy levels up, keeping those ready to eat foods available, making sure you're staying hydrated. Dehydration can also lead to fatigue. Easy to prepare options, smoothies, soups, packaged items. Some things that people slip their mind and they might not consider. Now we have online shopping, grocery delivery, so that's always a great option. Sometimes enjoying meals with family and friends can lift spirits and really make you want to eat if you're not feeling like it. Accepting help, that's typically a hard one for some people too. If your neighbors, friends, family are offering to cook or prepare or drop off foods, definitely take them up on that offer. If you're cooking a large meal, something like a casserole or soups or something, that's always a great option to freeze for leftovers. Have it in your freezer for when you least expect the need for it, and avoid excess caffeine intake, because that can lead to other side effects, dehydration, causing more fatigue in the long run. Nausea is another big one. Definitely attempting to try and eat those smaller, frequent meals. That can be, instead of the 3 main meals a day, something more along the lines of 6 to 8 meals. This can help manage your symptoms better. Eating before you get too hungry can lead to less overall nausea. Sometimes we need to consider more bland, starchy, liquidy options. Very highly sweet, fried, fatty foods, spicy, can make our stomachs a little bit more irritable. So I would recommend to stay away from those in times that you might be experiencing nausea. Drink liquids between meals rather than with, could be helpful for some. Also avoid activity too close after exercising, and also some like natural remedies such as peppermint tea, ginger tissues, those are good to have on hand too. Other management for constipation, we want to eat whole grains, fruits, vegetables, making sure we're reaching those daily fiber goals. But if you're eating the recommended fiber and not drinking enough fluid, it can be counteractive. So keeping that in mind too, we do need to make sure we're drinking enough. That could be anywhere from 8 to 10 glasses of water, sometimes more. Increasing activity is tolerated. Sometimes light stretching or a walk after eating can be helpful. Other natural remedies for this would be prunes, prune juice, dried apricots, papayas, pears, flax seeds, yogurt, or kefir could be helpful. So medical nutrition matters. There's a lot of controversy when it comes to hot topics in nutrition. Things that you might read about or someone's telling you to avoid might actually cause more harm than if you are including these things in your diet. So just keeping that in mind, always want to try and contact or look at reputable sources for information, specifically when it's in relation to nutrition and disease. So keeping that in mind, we'll go through some water. Not sure anyone has heard the hype about alkaline water, but that's one of the things that is currently being promoted to improve cancer outcomes. This is water that's, the pH is typically higher than normal water, processed, with acid added, things like that. But these waters are technically, it could be for a bottle of water like this, $5 more. But does that mean the health benefits that are being doubted are actually true? But the research currently doesn't support this. The main focus is consuming enough water. And you want to do that to be able to get nutrients to your cells, help your body get rid of the waste products. So that's definitely the main take home. You need at least 8 to 10 cups of water every day, more if you might live in a hot climate like Florida, or if you're exercising. But definitely you want to focus on the safety of your water sources too. You might need to drink bottled water or test well water every year for safety. Another hype in the nutrition world is around juicing. It's promoted to be an enhancer of the immune system, treat a variety of health conditions, but right now there's no convincing scientific evidence that it's proved healthier than whole foods. So making sure we are meeting our basic nutrition needs through our diet to get the amount of fiber, nutrients, everything else that we need. It might add some additional benefits, but other ways to do so would be like smoothies, where you're blenderizing the actual whole fruit instead of just juicing the pulp, getting all the extra benefits and removing it to just drink that. So also, when you are juicing, to make a whole glass of orange juice, you probably need somewhere around 8 to 10 oranges. But would you really sit down and eat 8 to 10 oranges in one serving? The answer usually is no. So definitely can promote overconsumption when you are juicing. But it could possibly be a good option for someone that might have chewing or swallowing difficulties, can't bite into the rind of a fruit, something like that. So definitely working with a dietitian if you are having those issues. would be something to consider, digestive problems, or anyone that's experiencing unintentional weight loss. Another topic is sugar. While researchers continue to investigate this, it's also anxiety inducing when it comes to the speculation of misinformation. Does sugar feed cancer? You really are taking it to an extreme if you're trying to restrict sugar completely from your diet. It's not really practical, not really safe. Cancer is multifaceted, complex. So trying to just keep in mind those focus points. Maintaining a healthy weight, eating that healthy balanced diet, consuming fiber-rich foods, it's much more beneficial. Limiting added sugars, so the recommendations for women is about 25 grams per day. Men, it's 37 grams. So that would be something to help lower stress levels. Another hot topic would be organic foods. Are those going to be better for us than conventional produce? So that's definitely a myth that they can hold extra protection against cancer. The research does not support that they've been known to prevent cancer either, and there's not right now a clear link between pesticides and the development of cancer. But what we can do is to reduce the exposure, making sure we're washing our produce. So that's either organic or conventional products. They also might contain bacteria that can make us sick. So there's other factors that play a part of this. So tips for washing produce, making sure everything's clean. We want to rinse those with cold water, not using soap. Produce wash, it's not needed from guidelines from the American Cancer Association. Using a small brush if your fruits or vegetables have rough or tough skin. Washing these items before you even cut them. Peeling away the outer leaves of the leafy vegetables. Those are all great tips to follow. Another topic in the health and nutrition world, specifically relating to cancer, is soy. So the American Institute for Cancer Research notes that having soy is safe. They recommend about 1 to 2 servings, no more than 3 if you are going to consume soy products to decrease cancer risk. It is also safe even for women who have a history of breast cancer or who are at risk for developing breast cancer. Soy products also have other beneficial health benefits. That can include lowering cholesterol, blood sugar levels. They have those antioxidants that we need. Also a great protein soy source, but we want to choose soy products that are more in their natural form. So that can be anything from edamame, tofu, tempeh. If you've ever seen those products, that's like more of a vegetarian, plant-based source of protein, but still great to include. Eating out can also be difficult when it comes to dealing with side effects, making healthy choices, maintaining a healthy weight. Typically when we go out, we're choosing options that we typically don't maybe make at home, splurging a little bit, want to enjoy ourselves, but we still need to focus on making those good choices even when we are out. Choosing a restaurant that might focus on fresh ingredients, maybe they have heart healthy or lower calorie menus available. That would be great to choose options from. Also menus that allow you to have a shareable portion or smaller size portion. Sometimes they have like a lunch or dinner portion. Choosing the smaller size portion. Typically what we need for a serving or a meal when we look at our food. Choosing baked, broiled, steamed options. Those are going to be healthier than fried foods. So any sauces I would recommend choosing to order on the side. That way you can add a minimal amount without overdoing it. Now restaurants even allow you to ask for your foods if you want just steamed vegetables without added butter, without added salt. Very, very flexible these days. So definitely want to try and make those choices if you can. Do your best to avoid eating at fast food if possible, at buffets. At least now, a lot of fast foods do have 1 or 2 items. The one that I personally enjoy would be Chick-fil-A, but there are some healthier options there. So sometimes that's all we can do. We still have to eat. We're all human. So just looking at menus beforehand if you need to make those choices ahead of time, looking at the nutritional facts labels. That's gonna be smarter than not eating anything or just going for whatever option because you're too hungry to think about it. Also choosing reputable restaurants where they're safely preparing your foods is gonna be best. Are they wearing gloves? Is there any cross-contamination? Are they washing everything? That's gonna be important to think about when you are choosing restaurants. And then this graphic is pretty great when it comes to what you're looking at on a menu, choosing a main dish, protein focused if you can. Those have healthier preparation methods on the side, adding extra vegetables if you don't want added fats, asking for cooked without butter or dressing, sauces on the side, not going too crazy with the bread basket or chips or anything like that. Appetizers still count towards the meal too, so keeping simple things like that in mind. There is some help from the Academy of Nutrition and Dietetics available online if you do need help finding additional nutrition guidance. It has a really great option where you can select to find a nutrition expert in your area if you want something more virtual versus in person. The help is available if you speak a different language and want a dietitian who's able to communicate with you. In your area, you just enter your zip code in, your city, they're able to give you access and they can help with those individualized recommendations. There's also a lot of nutrition support out there from the American Cancer Society, things like that, and that is evidence-based, research-based nutritious help. So using those sources rather than just a random blog or a post that was on social media, it's definitely gonna be more beneficial overall. And that's all I have for nutrition. Does anyone have any specific